anyway, I wanted to say thank you so much for inviting me today to come and speak to you. And also I wanted to welcome all the new and re-elected female MPs to Parliament. And also to say many congratulations to Labour on winning the last general election. So I think that's fantastic. We've all heard it. Women now make up 41%, which is fantastic. It's great progress. But sadly, the Women's Health Front has yet to make similar strides, because we have in the UK the widest gender health gap in the G20. Women have poor access to healthcare and are often dismissed when seeking help. They receive delayed diagnosis, and they get less effective treatments than men, and their pain isn't taken seriously. All of that is documented. There is data to prove all of that. The outcomes for women from diverse and marginalised communities are even worse. And I'm sort of thrilled today that there are two people here who we work very closely with. Tanya, please, there, and also Chloe, I think if she's still here, who runs 5 times more. Because black women are 4 times more likely to die in pregnancy and childbirth. Asian women are much more likely to be diagnosed with ovarian cancer at such a late stage that they often can't receive treatment other than palliative care. And disabled women struggle to access life-saving cervical cancer screening, something that we all come to expect is normal. And actually, for a charity like Wellbeing of Women, that is really sad for us, because actually we are a charity that fund research, education and advocacy. And we funded research that led to the link between HPV and cervical cancer. And that means that today there is a schools vaccination programme. We also funded research that developed the cervical screening brush tool. We developed that as well. And so the fact that some women are unable to actually access their cervical screening is really sad. But we can change all of that, and we need your support to make all these changes reality. When we work together, change happens more quickly and efficiently. And I can definitely say that because I've worked with Tanya on schools education. I've worked with Janet. We do research together. Carolyn Harris and I have done a lot of work jointly menopause. Tina Backhouse is down there. We work closely with Tina. In fact, there's so many people here that we work together with. And it means that we make change happen more quickly and more efficiently. But by raising all these issues in Parliament and directly to ministers, you can make a real difference for women and girls, whoever they are, wherever they're from. And that's really important, because we need to bring down waiting times for women's health and make sure that all healthcare professionals, at whatever level they are, know everything they need to know about women's health, and they understand the different approaches needed to reach diverse communities, because that is really important. And underpinning all of this is the need to invest in more women's health research. And I can honestly say that without Wellbeing of Women, we wouldn't really have the cervical screening programme or the vaccination programme. We are hopeful that there is going to be a new treatment for endometriosis, Cherry. So we're working on that now. We actually did all the early research into screening and ultrasound. So again, Wellbeing of Women has been a pioneer, and we are the only charity that funds in women's health across the life course. There isn't another organisation like us. So please, I ask that you all make sure that women's health research, that it's ring-fenced and that there is plenty of money available. I saw earlier that Lucy Chappell was here. I don't know if she still is. And I know she's doing fantastic work with the NIHR. And I just hope that they continue to make a focus for women's health, because we all deserve it. And as we know, if we get it right for women, everybody benefits, including all the men in this room, because we all have women in our lives. So thank you very much.